about their work. And obviously we didn't have the time, given we have one day to cover everything, or the money to bring in people. So this is a snapshot of a lot of examples of what's going on out there right now. It's still just little pieces of the puzzle, but they've been pretty successful. So we might be able to look at some of their approaches as examples for other types of AT or certain types of regions. And Deepti might help me. So Deepti helped me put this together. And also Mark, Mark, I didn't say at the beginning, was really helpful in organizing this whole thing, conceptually, of trying to figure out what the priorities, the objectives were, and laying out the schedule. So I'm going to look at kind of 4 general types of approaches, and we've already covered some today, and examples within those. So we have the do-it-yourself that we've talked about. There's actually, Maria and Kurt have put some examples out in the display area of very simple 5-minute solutions, and Bridget also presented a number this morning. We have some mainstream market models with just what's out there for everybody that is also accessible to people with disabilities, social entrepreneurship, and nonprofits. So the benefits of the do-it-yourself, obviously, is that it's very affordable, it's low maintenance, it's very easy to access as long as you can find that part of your store, and that there's some risks of the quality level, possibly safety risks, and also the scalability of when you're trying to look at a broader distribution of those solutions. A good mainstream model that I just found out about, there was a pilot study in Uganda from a group, I think it was a university in Cambridge that partnered with a deaf school in Uganda, and they were just looking at text messaging on cell phones and how that can be used to facilitate the integration between deaf and non-deaf students, and communication between the deaf children at the school and their parents that are possibly in remote areas. But as you know, cell phones are everywhere, so there's a chance that somebody has a cell phone in that rural area, or the family does. So the benefits of this is that it's financially sustainable, and there's very rapid proliferation. The risks are that sometimes these solutions, as we know, can exclude people, as well as work to reduce those barriers, because they're not necessarily focused on people with disabilities and their needs. Some examples that are, say, somewhat self-sustaining are Solar Ear, which is also part of our display, which is a hearing aid that was developed actually in Botswana, and then was very successful and became profitable, and is now being manufactured in Brazil, and with plans to scale up in like 5 other regions. So the problem was that the cost of hearing aids were out of reach, and the batteries would last about a week. So it was very unaffordable to most people. So the solution was designing a low-cost hearing aid. It's less than $100, and there's powered, rechargeable solar batteries that last 2 to 3 years. Still, $100 is way out of reach for probably the majority of people with that need hearing aids. But this is compared to, I don't know if anybody knows here the average cost in the US, but probably about $2,000. Yeah. So this company's been very successful. They actually generate 99% of their profits now, 1% from grants from individuals. But they also had initial startup funding for the R&D, and that's something I've seen as a theme throughout a number of the examples I saw, is that just to get things off the ground, there's usually some grant funding or investment. And they've sold 10,000 hearing aids, 20,000 solar chargers, and 40,000 batteries around the world. Another group, Shonequip, this was started in South Africa. This group manufactures, designs wheelchairs, and they're actually a corporation, they're not even a non-profit. So they sell to their government, who provides that provision, 65% of their sales, 25% through health insurance, and then 10% is sold to nonprofits, NGOs. This is in the display as well. They provided me with a catalog that has all their major products and all the specs on all those products. How do I go backwards? Okay. This model, because it was, well, not because of it, it was started by a woman, Shona McDonald, who had a child with cerebral palsy that needed wheelchairs and worked diligently to create one that was appropriate for that environment, and then that became well known and it's expanded beyond South Africa, and actually she's now being asked to expand her programming into some other regions of Southern Africa. But it's a very comprehensive program. It provides clinical services, training, maintenance, repair. It also is an employment program. So it's providing people with disabilities employment opportunities, and that's the same with Solar Ear as well. I forgot to mention that they actually provide training for deaf people that then work in manufacturing the hearing aids. There's two photos, a before and after photo here, and a little data that says 52 million people in under-resourced countries need a wheelchair, and 36 million need additional modifications. So the before picture is a child that's obviously, she's in just a regular car seat. And then the after picture is this child in one of Shona Equip's wheelchairs, which is a lot more appropriate and not causing secondary conditions as inappropriate adaptive technology can do. And this is their sales over the years. So they started in 2004, about 1,000, and they've gone up to over 3,000 in 2009 with plans to expand. And they are, given that they're a profitable company, they're constantly looking at cost effectiveness. So they're looking at making their delivery more efficient, and then also setting up these mobile outreach clinics in 4 other countries in Southern Africa. So Whirlwind Wheelchairs. This is another social entrepreneur model, but it's fairly large scale. But they generate most of their profits through sales, and it's mainly to NGOs. So far they've sold or distributed 50,000 wheelchairs. They also have a very comprehensive model where they've developed their wheelchair, this latest one, the Rough Rider, that they've trademarked, and they franchise with independently owned factories in 4 countries, Mexico, Vietnam, Turkey, and South Africa. And they ensure that the manufacturing meets their specifications, so they actually had a certification process to go and monitor those factories. And they also supply them with the designs, the specs, and the tools that they need. And these manufacturers then are able to distribute them freely within their own country with that small charge for certification. A great thing about Whirlwind is that they're very well networked within the international developed community, and they are functioning at a scale of production that they can respond to fairly large needs like the disaster in Haiti. So, as you all know, there's a estimated 2,000 new amputees after the earthquake in Haiti, and as many as 250,000 new injuries. So Whirlwind Wheelchair partnered with Handicap International and Partners in Health, and just at this point, I think the last I heard is they've been able to manufacture 350 chairs at their Vietnam, Mexico factories, and then distribute them through their partners in Haiti. This is an example of a nonprofit that started in Kenya by a woman who suffered from a spinal cord